Today I am joined by Claire Pesterfield and Dr. Claire Guest. They are our Showcasing Syncope Pioneers of 2023, and they are from the Medical Detection Dogs. Welcome, Claire.
Thank you. Thank you. So today we're going to talk about our work with our medical alert assistance dogs, who are a cost-effective adjunct in ongoing POTS management. So we're firstly going to look at who are medical detection dogs. So we are a charity, and we'll go through in detail about what we can do. We will then look at what are our medical alert assistance dogs. We will then look at our typical client, and we will look at how our medical alert assistance dogs can reduce injuries in those with POTS or syncope. We'll also examine some research regarding health economics and the quality of life when our clients are using our assistance dogs. And then we'll conclude how we can take all of this moving forward.
Who are medical detection dogs? Well, we're a charity that started following some anecdotal stories that dogs could actually detect human cancer. So these stories were published in the medical journal The Lancet and led myself and some colleagues in the year 2000 to start looking at whether or not dogs might be able to detect human disease by associated odour. Now, our publication was in the British Medical Journal in 2004, and it really led the way and started the sort of real understanding and belief that dogs could be used and could be trained to detect specific odours related to different diseases. Now, we continued our work, and those are our biodetection dogs, and that's the dogs that work on a stand system. If you see the first picture there. So these are dogs that never come into contact with a patient, but are in fact informing us whether or not a particular disease has a unique odour that can be detected in sweat or breath or urine. Now, moving on from cancer, we've also done work in malaria, Parkinson's disease, and a number of bacteria. But if you look to our right, this is our first sort of practical application of our work. So what we discovered is not only could dogs detect human disease in collected samples, but they could, of course, detect the odour of disease or a change in health status when partnered with an individual who had an ongoing medical condition. Now, our early work was all based with diabetes type 1, and you'll see a dog here. It's actually Magic, and Claire beside me, she may be embarrassed to say. And Magic is actually waking Claire up during the night at about 4 in the morning to warn her that she's having or about to start a hypoglycemic event. So Claire suffered from hypo unawareness, and Magic is able to detect, even during the night, that her blood sugars are becoming dangerously low, waking Claire up so that she is able to take her bloods and take glucose. These are the days before there was sort of there's some more superior technology now where people are able to use new devices and pumps. So our work with POTS has actually come from this work. So it's the partnership of our dogs and individuals, and we are full members of Assistance Dogs International, which is the accrediting body for assistance dogs around the world. So it would incorporate guide dogs, hearing dogs, and many other service dogs that people may have heard of. So the medical assistant dog is trained to alert an individual's change in odour which occurs prior to a medical episode. Now, this is the important part. So these dogs are able to give pre-warning, and therefore they enable the individual to take avoiding action. So, as I said, either preventing hypoglycemia, or in the case of our individual with POTS, not preventing the episode as such, but enabling the individual to make themselves safe prior to the event.
Okay, so our typical client who apply to medical detection dogs have often spent many years trying to receive a diagnosis. And we know that's quite common these days. Or they've often been given diagnoses of other conditions and have finally managed to see a cardiologist and then be diagnosed with POTS. Is that our clients will have actually gone through the full diagnostic framework, often using the tilt table test, blood tests, and seeing a specialist cardiologist. And they've also tried the usual management strategies that are often prescribed, such as the lifestyle changes, fluid intake, compression clothing, the progressive exercise strategies, and also medication. also find that many of the clients that apply to medical detection dogs also have additional comorbidities such as Ehlers-Danlos syndrome or hypomobility, mast cell activation syndrome, and severe gastrointestinal disturbances or urinary and bladder issues. So many of our clients have actually got a number of issues that are affecting them day to day. And we will liaise with their healthcare teams just to ensure that all the usual strategies have actually been tried and have perhaps not made a huge amount of difference to their patients' quality of life. So what we have done over the years that we've been training our dogs to alert to POTS episodes is we collect data as part of our application process. We need to see that patients are having episodes that are frequent enough that a dog will be able to remember the smell, but not too frequent where that odour is always present and therefore it becomes normal to the dog. We also need to be able to see whether the episodes are affecting our clients in other ways. So things like injury, particularly if they are suffering from hypermobility or Ehlers-Danlos syndrome. And so we collect data on minor episodes where it might just be bruising or swelling or grazes, or even more severe episodes that require either hospital admission or things like fractures and dislocations, which we often hear about. So what we have done over the years of working with our POTS clients is kept this data. And then what we also do is we reevaluate our dogs and our clients every year as part of a reaccreditation process. And that is something that's set out by Assistance Dogs International. We need to ensure that constantly our dogs and our clients are maintaining the standards that are expected of an assistance dog. So we collect the data every year to ensure that our dogs are still accurately alerting our clients to an impending episode. So what we did is we looked at our data in an in-service audit, and we looked at the 4 weeks of data that we collect prior to them receiving the dog, so as they apply, but also at their most recent time when they were reaccredited. And this time will have varied between the clients as we're looking at their most recent accreditation time. So it varied from just being a 1 year difference up to a maximum of between 4 years when they got their initial assistance dog and when they were reevaluated. So looking at the number of clients that we could assess, we found 5 clients that we could fulfill that time frame. But we must also remember that the data that they do give us is self-reported, either by themselves and or their family or their carers. So we know that the data perhaps isn't of gold standard, but it's certainly as accurate as possible that we can get it. What we wanted to do was to evaluate whether or not the number of episodes changed once they received an assistance dog, and whether the number of injuries and their quality of life had changed also following an assistance dog introduction. And so what we're presenting here really are those results. So as I said previously, we had 5 clients at the time of the in-service audit, and all clients at that point were female. Their average age was about 31, but ranged from between 23 and 40 years of age. And their range of time with their assistance dog was between 1 and 4 years, with a mean of approximately 2.2 years. Now, we know that quality of life often increases dramatically after getting an assistance dog because of the novelty factor. So we felt it was important to look at the most recent data of their reaccreditation process rather than their first collection of data following an assistance dog. So we could try and ensure that the novelty factor was removed, and we were just looking at what was happening at the latest time frame. So before our clients received a medical alert assistance dog, we found that there were a number of injuries that were happening fairly frequently. They would have a lot of episodes, so a mean average of 149. And with injury, there were 24 episodes within those 149. Once they received a medical alert assistance dog, the total number of episodes in that group of 5 clients was 452, a dramatic increase, which we're still trying to find out why that may be, but we have some anecdotal evidence from our clients as to why that might be, which we'll look at shortly. But you'll notice that following the introduction of an assistance dog, even though their episode frequency increased, episodes that resulted with an injury were actually dramatically reduced. And there were only 3 episodes that resulted in an injury compared to 24 previously. So why do those episodes increase? Well, the clients often report that they're now more confident in going out. Many of our clients are afraid to go out. And when we assess our applications, we look at those people where their life is extremely limited by POTS. So they're afraid to go out, they're afraid to go to work, or they're just physically unable to. And many of our clients have reported that following the introduction of Assistance Dog, they feel more confident because they are going to get that pre-warning to an episode, so they can make themselves sit down or lie down somewhere safe, rather than just collapsing in the middle of the street or the workplace, which increases their anxiety. We also know that it is a small sample size, looking at only 5 clients and assistance dogs across our time frame. And obviously there are some data collection issues as this time frame happened over the last few years, and we have tweaked the process as we've moved forward, looking at trying to better calculate the episodes that we're receiving and recording, and also trying to make sure that the episodes that we are collecting, the data, it can be extrapolated across all of our partnerships accurately. So what does this mean going forward? Well, if we look at it as an average point of view, without a medical alert assistance dog, 1 injury occurs approximately every 6 episodes of syncope in our clients. But once they have a medical alert assistance dog, they often will, or they will receive an injury approximately every 151 episodes. And that results in an 87% reduction in injury-related episodes with POTS. Something that our clients are extremely thankful for because of the effect that the injury will have on their ability to perform everyday tasks.
So a very, very exciting piece of early data. And as Claire said, you know, we're aware there's more work to be done. And there are some limitations. The data was collected in real time, but originally we did have different ways, different modes of collection. So that's something that moving forward we're improving. Yes, we have a small sample size, but it is within subject data, and it was longitudinal, so it wasn't recollection data. Of course, it gives it some more power. Improve validation of the results moving forward by using some additional factors as well. For example, quality of life, ability to return to normal daily tasks and work. And I think this will give us a huge amount of information in relation to the other point Claire was mentioning, which is why episodes actually increase hugely in individuals when they have a placement of a dog, but actually the person reports huge increase in confidence in being able to return to normal daily living. Something that's really exciting as well, which has happened at the same time as we were doing this work, is we have had a health economics assessment, and we now have a model and report that was carried out by MTEX Access, and we're very grateful to People's Postcode Lottery for funding this. Now, this used anonymised data, client data, and also looked at the backdrop of published literature and standard health economic methods. Now, as you'll be very aware, there's limited information in relation to POTS itself, so we did have to look at some other associated type conditions or similar type in terms of their impact for some comparison. But the use of the medical alert dog with associated reduction in injuries, ambulance call-outs and associated healthcare was then calculated. And it was the figure that has been reported is that we are saving the NHS over £33,000 over the placement time of the assistance dog, which is calculated at 9 years. Of course, the work of the dogs and the placement of the dogs goes much further than the NHS saving cost, because that's a cost saving to the health service, but of course by looking at the differences in the individual themselves, there's of course huge changes and benefits in terms of their quality of life and their ability to actually to return and deliver in society, and the net monetary benefit would be considered to be over £50,000. So in conclusion, the use of the medical assistance dog can significantly reduce the risk of syncope associated injury and therefore reduce related healthcare costs. Importantly, clients are reporting greater confidence in performing social activities and activities of daily independent living, with some even being able to return to work and education, which is something we're very much looking in the assessment now. And certainly medical alert assistance dog could be considered as an additional and cost-effective adjunct on ongoing POTS managements, particularly where other strategies have not had the desired effect. Moving forward, we want to improve our data collection methods and involve a greater number of partnerships. We want to change our quality of life assessment tool to EQ5D, which is well recognised within healthcare commissioning. And we're hopeful that this will enable us to examine other sources of healthcare funding to support the training of medical alert assistance dogs. Of course, as a charity, our big challenge is being able to train sufficient dogs to supply what is a growing need. And we want to be able to do this with maintaining standards, ensuring that our alerting ability of our dogs remains at the highest level, but to help as many people as possible. And to do this, we need improved links with specialist syncope teams and of course with funding bodies. So we'll be very grateful for anybody that is aware of any funding streams that might be able to support this work. So I'd like to thank you very much, and I know Claire Wood, for this opportunity. And we're very excited in these early results. We want to continue and move forward and show the real impact that these incredible dogs, with their sense of smell and their ability to do something currently and give an easy early warning, which enables an individual to maintain independence, something currently that medicine without machines and monitors is unable to do. So that's an incredible thing. And of course, there's the added companionship, and Iggy has managed to sit through the whole presentation to prove that how relaxing these dogs can be. I'm not sure he was helping me relax, but so thank you very much.
Well, thank you to both of you, well, all three of you actually. So absolutely fascinating study, and I'd like to say thank you very much for sharing that with us today. We know at STARS that syncope and related conditions can in some cases be devastating and have a huge impact on the quality of life of those suffering with these conditions. Having said that, so many physicians do not seem to take it as seriously or appreciate the impact that syncope can have on an individual's quality of life. So one of my questions today is, do you have any future plans to be able to offer this service to those in greatest need? And who or how can they access to getting one of the service dogs?
Yes, so our application process is quite lengthy, but that is designed really to find those who are most at need. The eligibility criteria is generally anyone over the age of 18 who has had the diagnosis for at least 12 months. And that's purely so we can ensure that they've had enough time to take on the strategies that have been suggested by their healthcare teams. And we also will contact the healthcare team as well, so we can ensure that, you know, they have looked at every resource possible for the applicant. We measure quality of life. We look at and we collect the data for episodes and injuries. So we are trying to get both an objective as well as a subjective view of each client before we make the decision as to who is able to receive one of our assistance dogs. The issue that we have, obviously, is that you can't just put any dog with any person. You have to find the right dog for the right person. So that often takes a little bit of time as well. So we try to get to know the applicants, what they're doing now and what their aims and ambitions are in life, particularly as we know that, you know, many of our clients will go on to achieve more. So again, the success rate of our assistance dogs is going to be as high as possible, because we're matching the right dog to the right person where they want to work together to try and improve their lives and be a happy partnership together.
Thank you, ladies. Yes, well, that certainly covers it on an individual basis. What more do you think can be done then to perhaps inform the healthcare professionals on the devastating consequences of living with syncope, and why potential solutions such as a medical assistant dog may be the answer for some people.
Well, I think, this is an opportunity, where we can not only get the name of medical detection dogs and what we do, out into the wider scope of healthcare professionals, but also what it is like for a person who has syncope. And again, that's why we collect quality of life data. We want to be able to publish data on, how quality of life is significantly affected by syncope and POTS. So I think this is a good start. But again, I think more publicity, working with specialist teams, getting our stories from our clients out there into the public domain, again, I think is an important part of our work to establish, that POTS is out there, it does exist, and it is a significant thing for our clients to have to live with, and can be quite devastating in many cases.
I think as well, and to add to Claire, that what we did find, and actually we're looking back now, sort of charities are going 15 years, unbelievably. When we started our work, as I mentioned at the start, with individuals with type 1 diabetes, often the general public and the awareness for people that weren't closely related to type 1 diabetes, were sort of had some sort of confusion that it was somehow the individual's fault, or that they were eating too much sugar or something. Quite ridiculous. With the story with the dog, it was very interesting how once, and it's not right, but it is the case that when some publicity goes out and there's a dog involved, people actually read and try and understand how the dog is helping and why the dog's helping. And in that way, they understand a lot more actually, and are much better informed about the challenges of the individual's condition. So we're really hoping that sort of, using the partnership stories, that the awareness of this very, very limiting condition will be increased hugely, and we're very determined to do that, and to not only show how the dogs can help, but to highlight the challenges that individuals do experience.
Thank you very much, ladies. Very informative, and obviously a very, very, very good presentation. So I'd like to say congratulations once again, and thank you for your time and sharing that with us today. Thank you.
Thank you very much.